Picture this. She squats down in the bathroom in the morning and she feels it. A lump right there. She stands back up, gone. She checks again, nothing. So she thinks she imagined it. The next day, the same thing. Squat, lump. Stand, gone. She's been on Google for 3 nights, Facebook, Reddit groups. Nobody has the answer. But here's what none of those groups told her. A lump that comes and goes is not random. Hi, I'm Dr. Sylvia, NHS GP and women's health doctor. Today, I'm covering 3 specific causes of a come and go type lump down there. I'll tell you how each one behaves, how you could tell them apart, and exactly what to say at your GP appointment so you don't leave without the right answer. The vagina is the internal canal. That's the tube leading to your cervix, the first part of the womb. The vulva is everything on the outside. Here's what cause 1 could be. A vulvar varicosity is a varicose vein in the labia or one of the lips around the vagina. Exactly like the varicose veins that people get in their legs, but located in the outer vaginal lip, the labia majora. The veins there can become enlarged, dilated and bulky. And here is exactly why it comes and goes. This is the key thing I want you to remember. When you squat, strain or stand for a long period of time, the pressure inside your abdomen increases. That increased pressure pushes blood into those veins in the labia, and so they swell and you feel a lump. The moment you stand normally, sit or lie down, the pressure drops and the blood drains away. The lump disappears completely. How do you know it could be a varicosity? Well, this is a diagnosis for your doctor, but here are some clues. It's more noticeable around your period. Hormones make our blood vessels dilate or get wider, increasing blood flow. It gets worse during pregnancy. It feels soft and slightly squishy, not hard. It might feel heavy or achy, but not acutely painful. The skin overlying it looks completely normal. No color changes, no sore. The good news, most vulval varicosities are benign and need no treatment unless they cause significant discomfort. Check out this video here where I discuss the subject in a little bit more detail. Now stay with me until cause number 2, because that's the one that gets missed quite often, even by doctors. But you still need a GP to examine it and confirm. Never self-diagnose a lump down there. Now, cause number 2. This is the one that many people haven't heard of, and it's the one that occasionally gets sent for scans before anyone thinks to check for it. So stay with me. Can I tell you something that surprises many of my patients? Women can get groin hernias too, and one of the most common underdiagnosed causes of a come and go lump in the labia is an inguinal hernia. Okay, so here's what happens. Running through your lower abdomen is a natural passageway called the inguinal canal. In women, a ligament called the round ligament passes through that channel. If there's a weak spot in the wall of that canal, abdominal tissue, sometimes even a loop of bowel, can push through and travel down into the labia majora. And just like cause 1, it appears when you strain or squat or cough or lift something heavy, and disappears when you lie down or relax. Identical behavior, different causes. Now, the clues that make it more likely to be a hernia than a varicosity: the lump feels firmer and not soft. It might have a slight gurgle when you press it. That's if there's bowel inside it. You feel a pulling or dragging sensation in your groin with it. It's appeared more suddenly and not over years. It can be specifically triggered by coughing. Now, an inguinal hernia can become an emergency if the bowel within it gets stuck and cannot reduce. This is called a strangulated hernia. If a lump that usually disappears suddenly stays and becomes very painful, that's not a wait and see situation. You need to go to the walk-in clinic or your nearest emergency room. Now, cause number 3. This one specifically shows up after sex or around certain times of your cycle. And when I explain it, you're going to think, why has no one ever told me this before? Let me introduce you to your Bartholin's glands. You've had them your whole life. You just weren't properly introduced. They sit at 4 o'clock and 8 o'clock, right at the opening of the vagina. Their entire job is to produce lubrication when you're aroused. Now, the tiny duct that drains each gland can get blocked. When that happens, fluid builds up behind the blockage and you get a Bartholin's cyst. Small, soft, smooth like a marble, sits right at the entrance of the vagina. Now here's why this one can also seem to come and go sometimes. During high estrogen times, middle of your cycle and before the next period starts, the gland produces more fluid. The cyst grows a bit bigger and so you're more likely to notice it. And then it settles down so it can fluctuate with your cycle. After sex, when the gland has been at its most active, a cyst can suddenly become more noticeable. So that lump that appeared suddenly from nowhere after sex, quite possibly a Bartholin cyst. Now, here is the critical thing I need you to know. There's a big difference between a Bartholin cyst and a Bartholin's abscess. A cyst, soft, painless, mildly uncomfortable, no fever, skin looks normal. An abscess, rapidly growing, very painful, hot to touch, and you're developing a fever. Cyst, routine GP appointment. Abscess, walk-in clinic, emergency department, or A&E, same day. I know some of you watching this are wondering, what if mine is something more serious? So let me address that directly. A lump that comes and goes is mostly reassuring, but still needs checking by your doctor. Lumps like that respond to pressure, filling up with blood or fluid or tissue, that's mechanical. It's not typically the way that cancer behaves, but having any of these red flags changes the picture. The lump stops disappearing, it stays permanently. The skin over it changes, it gets thicker or changes color or develops a wound or sore that doesn't heal or get better. It starts bleeding or develops into an ulcer. You feel more tired than what you'd expect, or you're losing weight when you didn't really plan to, or a lump that used to be soft now becomes hard or feels irregular. Any of those, see your GP urgently and ask specifically to be referred for an assessment. Don't wait, don't Google this, just go. Okay, now let's make sure you get the right answer at that appointment, because how you describe this matters enormously. So tell your GP, it comes and goes when I squat or strain, stand, or after having sex. And then say it disappears when I lie down or sit down normally. Say it's been there for however number of months, or it just appeared suddenly. Also say the skin over the lump looks completely normal, or the skin seems to have changed. Tell them it's painless, or it gets sore before my period, or it suddenly becomes very painful. Here's why this is so important. If a GP just hears a lump down there and examines you while you're lying on the couch, they may find nothing because it's a positional lump, and they might reassure you without getting the right answer. But hearing a position-dependent lump that reduces on lying tells your GP exactly where to look clinically. That description could save you months of confusion. Had you heard of a vulval varicosity before watching this video, or heard about an inguinal hernia in women? I'd love to know. Drop a comment for me below. Type varicosity if cause 1 was new to you, and type hernia if cause 2 surprised you. I read every single comment and it tells me what to prepare next. Now, if this video helped you feel less panicked and more prepared, please share it with someone who deserves to have this information. That's why this channel exists, and I'll see you in the next one.